For such a common condition, arthritis sure has a bunch of myths surrounding it. And while myths can add an element of mystery and excitement to subjects like aliens building the pyramids or the existence of Bigfoot, they can also shape people's decisions, sometimes to their detriment. And this is the case for arthritis. I witnessed firsthand how unfounded beliefs about arthritis can profoundly affect patients' perceptions of their bodies and their behaviors. So to debunk these misconceptions, we've compiled 4 common myths that surround arthritis. Hey everybody, welcome back for another episode of Physio Show, where we answer all of your rehab-related questions. The first myth makes me want to cringe every time I hear it. While joint replacements have indeed advanced over the years and can offer significant relief, surgery should never be the first resort. Unfortunately, this misconception often leads to premature consideration of surgery, fueled by defeatist mindsets. And that's unfortunate because managing arthritis takes hard work and dedication. So if your motivation isn't there from the get-go, then it can be tough to effectively manage the condition. And there are numerous non-surgical options, such as lifestyle adjustments and targeted therapies, which can effectively manage arthritis symptoms without relying solely on medication. And let's not ignore the reality that is total joint surgeries. They're invasive, require extensive rehab, and carry risks. So before jumping straight to surgery, explore all non-surgical options first, including weight management, healthy eating, exercise, and stress management. Prioritizing these lifestyle changes can significantly reduce joint stress and inflammation, leading to pain relief and improved mobility. And by embracing non-invasive strategies, you might just avoid surgery altogether. One of the most common myths individuals with arthritis face is the belief that pain equates to joint damage. While yes, arthritis does imply there are degenerative changes to the joint, pain is not that straightforward. Pain is simply an output of our body, and it's not always a reflection of tissue injury. But because most equate pain as a sign of harm, this is usually followed by a fear of movement and physical activity, preventing people from living fully. However, it's important to understand that pain doesn't always indicate ongoing joint damage. Pain can stem from a variety of sources, such as inflammation, muscle tension, and exaggerated pain responses, like a car alarm that sounds off at the slightest breeze. Arthritis can result in alterations in our nervous systems, heightening the sensitivity to pain signals even in the absence of harmful situations. So while certain movements may temporarily increase discomfort, they don't necessarily cause harm. In fact, avoiding movement can worsen symptoms by leading to muscle weakness and stiffness over time. Instead, listen to your body and ensure symptoms remain manageable during the activity. Now, if pain persists or becomes severe, then adjust your exercises accordingly. Working with a physical therapist can be invaluable in developing a safe and personalized exercise program tailored to your needs and limitations. Remember, movement is key to managing arthritis pain and improving overall well-being. This myth couldn't be further from the truth. While arthritis pain may make movement uncomfortable, exercise is essential for effectively managing the condition. Research consistently shows that exercise is the cornerstone of arthritis management, offering significant benefits to joint and muscle health, pain reduction, and overall quality of life. It's essential to understand that discomfort during exercise does not equate to harm. With the right guidance, you can safely engage in physical activity to improve joint function and reduce pain. Physical therapists are experts in developing tailored exercise programs that accommodate your arthritis symptoms and help you move more comfortably. Remember, avoiding movement altogether can worsen symptoms over time, leading to increased stiffness and decreased mobility. By gradually increasing your activity level and incorporating flexibility, strength, and aerobic exercises, you can alleviate joint stress and improve your overall well-being. Don't let fear of pain hold you back. Embrace exercise as a vital tool in managing arthritis and reclaiming your active lifestyle. Contrary to popular belief, physical therapy is beneficial for individuals with arthritis at any stage of the condition. Whether you've recently been diagnosed or have been managing arthritis for years, physical therapy offers immense value. Early intervention with physical therapy can help slow disease progression, prevent further joint damage, and improve overall function. Physical therapists provide personalized care tailored to your specific needs, whether it's education on joint protection techniques or customized exercise programs. By addressing the unique challenges of arthritis, physical therapy can help people with arthritis lead fulfilling lives despite their diagnosis. So don't underestimate the value of physical therapy, no matter what stage of arthritis you're in. It's a crucial component of arthritis management that can make a significant difference in your quality of life. Well, I hope you enjoyed this episode of Physio Show. Make sure to give this video a like and subscribe to the channel so you can learn more about your body, how it works, and what it needs to keep moving.